Jim Monahan here on the Jersey Magazine at 105.5 WDHA. June is Veterans Suicide and PTSD Awareness Month. And my guest this morning is Sarah O'Brien from Ark Behavioral Health. Sarah, good morning and welcome.
Good morning. Thank you for having me.
Sarah, tell our listeners about Ark Behavioral Health and what it is that you do.
Certainly. So Ark Behavioral Health is a dual program. We focus on substance abuse as well as mental health. We also have a specific program dedicated to first responders and veterans. Our frontline program targets substance use as well as PTSD, anxiety, depression, really allows the individual to figure out the track that works for them to get sober, remain sober, and start to heal, and get back into their normal day life.
I know this is a really, really broad question, but what do you think is the underlying reason that veterans have these issues?
I think there can be so many, and I believe, some of the big ones, are returning from, a certain area, whether they were overseas, whether they were active in the military, whether they were in a boot camp or with other individuals. And the lifestyle became somewhat of the norm. A lot of these men and women have seen and, witnessed things that most people will never understand. Drinking and using substances allows for some relief, from these traumas, from these PTSDs, maybe for a good night's sleep, some time away from these nightmares that they may be having. I think returning back to a somewhat normal life can be extremely difficult. It's taking an individual who has been in this environment for so long, that has, prepared and had a team behind them, and returning back to a somewhat calmer environment can be very overwhelming. We see a lot of individuals turn to drugs and alcohol to really, escape from that.
I've noticed, and I've talked with a number of veterans, even some veterans who were deployed overseas, but not necessarily in a combat situation, experience some of the same issues that those veterans who were in combat situations experienced. Why do you think that is?
I think what it comes from is, like the ability to really struggle well. They've done a lot of studies that individuals that have experienced combat and have experienced really difficult, terrible situations overseas return home and are able to somewhat adapt a little bit easier, than the individuals that may not have experienced that, strictly because of, the gratitude they may feel from what they've seen or what they've witnessed. Whereas others are really kind of that fight or flight that they're preparing for what they may or may not witness when they, when they join, when they give up their lives, where they defend our country and, protect our families. And being, trained in that way and then expected to return home and act in a different way, can be very, very difficult. It's the mind. It's really preparing yourself and always being on edge.
I've spoken with a number of veterans from the Vietnam era, which is closest to my age group. I missed Vietnam by a few years, but that's the veterans age group that's closest to mine. And, one of the things that came out was the 8 weeks of basic training and however many weeks you had of advanced infantry training. You're suddenly 10,000 miles away from home in a country that you might not have been able to point out on a map a few months earlier. You come home from that after your tour is up, and you're immediately thrust back into the world, as they called it back here in the United States, with really no reorientation necessary to get you accustomed, to what you had been experiencing, to what was going on here. How much of a factor do you think that is?
See, I think that's probably one of the biggest factors. I can't speak for myself, but I can only imagine, the want for these individuals to be back home with their families and their loved ones, to be reunited, but to be, thrown in that new environment, to not understand the language, to not, know their surroundings, the culture, what's appropriate, what's not appropriate, how to act, how to behave, how women are treated, how men are treated, how children are treated, whatever it may be, and then to be brought back in to what we consider as normal, can be, extremely difficult. It is like it's adapting and it's surviving. and then you're coming back and now you have to do that process all over again. From what you've done in the beginning is learn how to adapt and survive back in this so-called normal life that you left.
We're talking with Sarah O'Brien this morning from Ark Behavioral Health here on the Jersey Magazine, specifically about some veterans issues. One of the things that I think you deal with a lot is ending the stigma. And we talk a lot about that with just mental health in general, never mind veterans. How difficult is it, do you think, for that end the stigma to happen with veterans?
I think it can be extremely difficult for these individuals. They have these zero tolerance policies. They feel that lack of confidentiality. The fear that seeking this help for their mental health or substance abuse issues would really negatively affect their careers. And just judgment from peers or from superiors. Desire to like have a strong presence, a strong exterior for what they are, which are our heroes, and having to live up to that, can really be very, very difficult. They have, they go off and they fight, they go to these unknown territories, they leave their families, they leave their homes, they leave their careers, then they come back, and they suffer with these really serious issues. And that stigma can really prevent them, from getting help, where it's that the drinking and the drugging is almost easier than asking and admitting that maybe I have a problem and maybe, and what's that going to do, for my life? What's that going to do for the job, for the career, for this passion that I have moving forward?
I know the whole end the stigma, and you were talking about zero tolerance policies and lack of confidentiality. I think that's starting to change. We had Congressional Representative Mikey Sherrill on a few months ago here on the Jersey Magazine. Mikey Sherrill represents the district that our radio station WDHA is in. She's also a former Navy helicopter pilot and was deployed a number of different times. And she said that one of the things that when she looks back on her military career, if there was something she could have done differently, if someone came to her and said, I'm dealing with this issue, her first reaction was, you should talk to the chaplain. And she said that that's starting to change. And she wishes that it had been different when she was in the service, where I think the military is gradually, even if it's slowly, starting to set up some kind of a network for these men and women, no matter where they've been deployed, to seek out some kind of help to quote unquote end the stigma associated with this.
Absolutely. I think they're doing a wonderful job. And I think what's happened is over the years, they've seen that uptake and they've seen the individuals that have struggled. They've seen the higher, rates of suicide or overdose related deaths, and something has to be done about it. And, that goes for across the board. I think a lot, whether it's big businesses, colleges, universities, whatever it may be, are starting to see that this issue just doesn't affect a certain class of individuals. It touches and affects everyone's lives, and having the proper treatment plan, having those things in order, so the individual doesn't need to struggle in silence. Because I think for so long, that's exactly what they did for this fear. Opening that up and developing these programs allows people to not feel alone. It allows these individuals to say, other people are struggling like I am, and there is help available. I don't need to feel fear. I don't need to feel inadequacy. I don't need to feel this way. I can actually reach out because these programs are dedicated for individuals like myself, and I think that is so important because if anyone, needs help, they shouldn't be doing it alone.
June is Veteran Suicide and PTSD Awareness Month. Sarah O'Brien from Ark Behavioral Health, my guest this morning here on the Jersey Magazine. Sarah, tell our listeners about Ark Behavioral Health, what it is that you guys do there.
Certainly. So Ark Behavioral Health, Substance Abuse and Mental Health Treatment Center. We have facilities across the state, and we're extending nationwide into New Jersey and Ohio. Across the state of Massachusetts, we have all levels of care, including a medical detox, a residential 28-day program. We have outpatient programs. And we also, our most recent and our most proud program is our frontline program, dedicated to individuals who are first responders or who are veterans that are struggling with substance abuse and mental health that can receive, the help that they need, to get back on track and to be able to, live happy, sober lives.
And how does it differ from what the Veterans Administration offers through the VA hospital, Sarah?
So we work pretty closely with the VAs locally to us. What we are is just an added resource to them when they have overflow, when they have a lengthy wait list, when they have individuals that are seeking longer term care that maybe they can't provide. We're there to step in to allow them, to make that referral to get the individual into treatment. Mostly when we've seen individuals come in, they've come in from the VA, they've detoxed safely at the VA. They made the referral and they've come into our inpatient residential care for 28 days where they're stabilized, where they start to do that really intense one-on-one therapy, where they start to plan out how moving forward, they're going to continue on, whether it be with individual therapists back at the VA, outpatient programs, different type of therapeutic techniques. And that's kind of what we've done is worked with them as best as we can just to be an added support for them.
For WDHA listeners who want to learn more about Ark Behavioral Health, they can go online to arkbh.com. That's arkbh.com. Sarah O'Brien, thank you for your time this morning and continued success with the program at Ark Behavioral Health.
Thank you so much for having me.